My name is Erin Mandeville. I'm one of the midwives at the Women's Center at Copley. I see patients in our office at the Women's Center and catch babies at the birth center. So we tend to think of specifically urinary or fecal incontinence as being more common in someone who has had a vaginal birth, although that's not always true. Just stress and over time, poor posture, sometimes carrying more weight, cancer treatments, surgery, different things. All of these things are conditions that can have a component to them that can be addressed with pelvic floor physical therapy. So the pelvic floor, you can think of, if this is your pelvis, we have this hammock of muscles that make up the pelvic floor. And there can either be slack in the pelvic floor, so some weakness there. There can also be tension. So we think of if you have some coughing, sneezing, leaking of urine, we think, oh, there's weakness, but there can also be a tension pattern. If it's in spasm, it's not a functional muscle. When we see patients, we're also able to make a brief assessment of pelvic floor health and talk to people about things that they can do to prevent worsening of pelvic floor weakness or tension. Many people have heard of Kegels. We like to check to make sure that people are doing Kegels in a way that is correct and helpful to them. If pelvic floor PT is indicated, we would talk to them a little bit about what that treatment might look like and then make a referral to a pelvic floor physical therapist. We're fortunate here at Copley to have a really lovely pelvic floor physical therapist on staff. I think also it's important to note that people think it's very normal to have leaking of urine. We hear our mothers, our aunts, our fathers. This is not just a issue for women, but we tend to hear and think that, oh, that's just what happens when you get older. But the reality is that if we can address these issues earlier on, we can prevent that from happening.